Despite some of the holes in the evidence, the American Diabetes Association has put together guidelines for physicians based on the evidence that exists. And so currently they're recommending that for patients in the hospital on the ward, not in the intensive care unit, that the pre-prandial blood sugars be kept between 90 and 130 ideally, and all blood sugars, including postprandial, be kept less than 180 milligram per deciliter. So that's what we're shooting for. I think most hospitals that are striving to achieve those goals have put together multidisciplinary teams to work on developing protocols for their physicians and nurses to use. So here we've actually, we put together a team of both nurse managers as well as nurse educators. We had a pharmacy involved as well, and then myself as a hospitalist and another endocrinology physician on the team. And we've put together some protocols using what we call basal and bolus insulin protocols. I think what most places are doing is moving away from continuing patients on their outpatient diabetes pills and moving more toward using insulin in the hospital setting. The reasons for that are that insulin really allows us to more quickly adjust to achieve good glycemic control, whereas oral agents take a much longer time to work. And in addition, given the rapid changes in patients' nutritional status in terms of whether or not they're allowed to eat and tests they may be undergoing, so on, changes in their illness, insulin just allows us the opportunity to quickly adjust for those things. Whereas if they're on, for example, a sulfonylurea and they miss a meal, then they're more likely to have a low blood sugar. So what we're doing is moving toward using long-acting insulin for the fasting state, and we use insulin glargine here. And then a rapid-acting insulin that can be any of the very rapid-acting insulins available. We are currently using Novolog here. We have protocols in place for physicians, and it gives them a way of thinking about each individual patient that's admitted. So a big part of this initiative really has been education of both the physicians and the nurses to teach them, why it's important, why are we moving away from sliding scale alone, and also how to safely and effectively use basal and bolus insulin protocols.